Hi Skin Babes, I'm Nicole Pence BECKER, and thanks for joining me right here on my YouTube channel. By now, you know that I am obsessed with skincare. I love to focus on skincare, and I love to focus on it every single day. Consistency is key. But I do have one trick up my sleeve, and I'm talking about Botox. I've been getting Botox for about 4.5 years right here at Dr. Gregory Chernoff's office in Indianapolis, Indiana. And I thought, why not bring you along for this Botox appointment so you could see exactly how it all goes down. Skin Babes, get to know Dr. Gregory Chernoff from here in Indianapolis. He's such a wonderful doctor, not only because he cares about his patients, but because you know what you're doing. So
thank you, Nicole.
Thank you for being here to explain this. So let's just start with the first question, which is, what is Botox?
Botox is the most popular, one of the safest drugs that's used in a cosmetic office like mine. It's a purified protein that's developed from bacteria the same way that antibiotics are. And it's really akin to putting a child-proof cap in an electrical outlet. It blocks the connection between a nerve and the muscles that cause unwanted dynamic lines, most commonly unwanted scowl lines.
I got those pretty bad.
Crow's feet, bunny lines.
Oh, yeah.
Many times we can use it to bring up the corners of the mouth.
Okay.
Some patients we can inject their masseter muscles, their parotid glands, to affect facial thinning. It's FDA approved and life-changing for migraine patients, for patients with hyperhidrosis or excessive sweating of their palms, armpits. So patients love it. It's a very safe drug to use, and like I said, one of the most commonly used in an office like mine.
And one of the biggest reasons that I chose to do Botox about 4.5 years ago was actually right after my wedding. I don't know if you know that. And I regretted not doing it before my wedding. I was so nervous about just what it would look like. And you did assure me, you know, it's not going to change your look at all. It's just going to make you look less tired. And it does. That's what I think for it.
The nicest aesthetic procedure is the one that you and I can't tell was done. So anytime you and I can tell that someone has had something done, whether it's Botox, a filler, a non-surgical laser, or surgery, that's not an aesthetically pleasing result. That's not what we're after. People will notice that you look your best, but we don't ever want them to know you've had anything done. It's none of their business.
All right, let's get this Botox party started, but it's not a party because it's with a doctor. And again, my suggestion is that you go to somebody who knows what they're doing, and the Botox party at a friend's house is not a good way to go, Skin Babe.
So when a patient comes in for Botox, we ask them, when you look in the mirror, what features are you wanting to soften? And as if you scowl for me, so you can see your scowl lines are prominent. Sometimes patients don't like their bunny lines. Raise your brows. Your horizontal brow lines, give me a big grin. Your crow's feet aren't bad today, so I don't think we need to see your crow's feet. And so there have been very safe studies done that tell us how many units of Botox to put anatomically based upon the muscle thickness to give the result that we want. And again, we just want to soften your appearance. We don't want to give you a done look or a frozen look.
Yeah, nothing like Elsa, right?
No, so, and a little bit of burning. Good job. Proud of you.
To me, it really just feels like, a tack, like when you accidentally put your hand on a tack and it kind of like stings you for a second. But I know pain is very individual.
Pain is very subjective, very individual. And raise your brows now and relax. You feel 3 pokes here. 1, 2.
See, that area is a little bit more sensitive than that area for me.
Last poke here, 3. And for pain, again, we now have a new system called Pronox, which is a 50% nitrous oxide, 50% oxygen delivery system that we can offer to a patient with their Botox. And in doing that, they really feel very little. So it's really the plastic surgeon's equivalent of getting a patient laughing test. So now we'll finish off. You'll feel 1 poke in the middle. Raise your brows again. Relax. And the last 3 pokes. 1, 2. Raise them again. 3. And that's it. You can see the very tiny needle pokes. Now we hold pressure.
So Dr. Chernoff, there is a maintenance involved with Botox, right? Because it is somewhat temporary. Is it safe to say it's temporary, or what do you kind of classify it as?
It is. It wears off. Usually most people get about 3 months of activity. It starts to work in about 72 hours, and on average patients get 3 months of benefit. And I always say to patients, keep a log of how long you like that you look the best for, because every patient is a little different that way, and we're better to fill up the tank when it's a quarter empty, not letting all of the activity come back.
A lot of people are wondering about price of Botox. So, and as you mentioned, it really depends on how much you get, but what's the average person spend on Botox?
So the average in an office that does this full time would be $12 a unit to $15 a unit. So 25 units for you today would have been $300. Up to $600 if we also include the crow's feet.
And I gotta ask, because I think it's one of those things that people say, well, if I have really good skincare, and if I do masks, each week, and if I drink water, I can fight some of my wrinkles, but you can't fight them all.
These are expression lines, right? So, so Botox is not for treating static wrinkles, the wrinkles that you see without expression. Those are the facial wrinkles, the product wrinkles. But when we're talking about dynamic lines, we have to treat the muscle. So there's nothing you can put on your skin or your mouth that will decrease your dynamic lines. Botox is the only treatment for that.
All right, Skin Babes, and that's a wrap on my Botox appointment. So what did my forehead look like after I got Botox? Here's a picture of me just a couple days later, and my Botox always seems to last about 3 to 4 months. So that's good to know if you're interested in Botox too. Be sure to check out this blog post for all the information and for the follower perk from Dr. Gregory Chernoff right here in Indianapolis. Have a great day, Skin Babe, and be sure to focus on self-care and your skincare.